morning. On behalf of my fellow Butler County Commissioners, T.C. Rogers and Cindy Carpenter, my name is Don Dixon, and I wanted to welcome all of you here. The County Commissioners and the Butler County General Health District Commissioner, Jennifer Baylor, along with our other partners, have worked constantly to help flatten the curve of this virus outbreak in Butler County. Commissioner Carpenter wishes she could be with us today, but she's displaying flu-like symptoms, and she's doing the right thing by staying home. We wish her well. We are here to give assurance that our county services network is continually working to prepare our health resources to be ready for what might happen next. And we hope that those facts will help counteract some fear that's out there and unknown. To promote physical distancing, most of the meeting has elected to view via Facebook. People provide questions or comments which we can address at the end of this session. And you would address those to its Facebook Live address is facebook.com/TV Hamilton, Ohio. And let me repeat that. It's facebook.com/TV Hamilton, Ohio. Today we want to connect with the residents of Butler County and share relevant information impacting their lives and their neighbors' lives. In a minute, Health Commissioner Bailey will provide an update on our current status and statistics of those affected. The Board of Commissioners wants everyone to understand that Butler County's efforts are focused on mitigating this pandemic in ways which recognize the humanity of those affected. They are our neighbors, our mothers, our fathers, sons, daughters, friends. After Health Commissioner Baylor provides an update on those infected with the virus, Ken Wilson, Vice President of Programs, will speak to us specifically the effect that the pandemic has on our precious senior population and services Butler County is providing in concert with the Council on Aging. So most of our comments today, or the Commissioner's comments today, have set this up to be information for our senior population. But there's all other kinds of information included in this, so we hope we can help answer some questions and alleviate a little bit of anxiety. And with that, I would like to ask our Health Commissioner, Baylor, to come up and give us her report. And I can just say that she's working tirelessly. All of her people are. So she's doing a great job, so we don't know what we do without her. Mr. Commissioner.
Thank you, Commissioner. Good morning, everyone. I'm pleased to be here with you today to give you some of the data. One of the functions of the Public Health District is to make sure data is available to help us understand outbreak situations and make our responses appropriate. I'm going to start out with a quote from my friend Ann that I saw this morning, and she said, "I am 67 years old and my job is to stay home and stay healthy." So that's our theme in public health right now, and I think she stated that well. If you are a senior person, your job right now is to stay home and stay healthy. We're going to give you some numbers from our latest epidemiology report. So as of today in Butler County, we have 22 cases known to us that are positive for the COVID-19 virus. I will tell you that that's not an all-inclusive number. We know that there are people who are positive who have, number one, not been tested, or who have been tested and their results have not been reported to us. So I'll just say we have 22 that we know of, and the number is higher than that. Of those 22, 8 have recovered. It took them approximately 11 to 24 days to recover, with the median length being about 16 days. And that means all of their symptoms being gone. The cases by exposure type might interest you. We have 11 cases who are known to be in contact with another positive case, and so that's how they became sick. We have 4 persons positive who have had unknown community transmission, meaning we don't know how they got the disease. We have 3 people whose cases were associated with travel either to another country or another place within our country that has a number of known cases. And there's 1 under investigation. If you're adding up these numbers, they add up to 19. And if you are a person keeping track of this, you may wonder why I said 22. And that is because we've had some new cases reported out today. We have about 47% of our cases are male, and 53% are female. That equals 10 people, but it's 53%. By age, the seniors occupy about 26% of our positive cases, and then those younger than that are just about equally split between those 50 to 65, 21%, 35 to 49%, 35 to 49 years, 26% of our cases. 25 to 34 years, 16% of our cases, and then 10% are under the age of 24. So for those in the high-risk categories, which is anyone over the age of 65, so our seniors, and those who have other comorbidities such as heart disease, diabetes, or other chronic diseases, that's what we call our high-risk category for this disease. Of those who are hospitalized, all of them were in the high-risk category. Of those who were not hospitalized, the majority were low risk with a few high-risk people. So some of our high-risk people did not have to be hospitalized, but all of our hospitalized people were high risk. For all of our cases, we have about 8 out of 19 who are in the high-risk category, and 11 out of 19 who were considered in the low-risk category. So those are my stats for you for Butler County today. We are about in line with the state as far as what they are seeing. My parting words from me personally are, if you don't have to be out and about, please stay the heck at home. That's my plea for Butler County right now. So I'm going to introduce to you Ken Wilson, who is going to take it away from me.
Thank you, Commissioner. At Council on Aging, the individuals that we are serving are most at risk for severe complications to COVID-19. Our priority is protecting the health and safety of seniors, staff, and our volunteers. We are following all the public health guidelines while continuing to serve seniors throughout Butler County. To date, most services have continued without interruption. Services such as Meals on Wheels and personal care. We are contacting all seniors on our program to check on them and identify any additional needs and appropriately respond. For the Butler County Elderly Services Program, that means we're contacting over 3,000 seniors. Our care managers expect to have reached everyone by April 3rd. At Council on Aging, we began planning for COVID-19 in late January. In February, we were securing support from our funders to enable us to begin preparing 14-day shelf-stable food boxes in the event that we had a supply chain issue, a shortage of drivers, or if seniors could not get out. Thank you to Butler County, who quickly responded and gave us the green light. To date, 1,508 food boxes have been delivered to seniors throughout Butler County. All current home delivered meal recipients or Meals on Wheels recipients will have a food box delivered to them by Monday. Many older adults who have not needed help in the past are now reaching out to us because of the pandemic. We've set up a hotline at 513-721-1025. People that are calling are afraid to leave their homes to get essential supplies, such as food or personal care items. We are providing home delivered meals to those seniors who are reaching out because they can't leave their home and they don't have anyone to go to the grocery store for them. Some are lonely and afraid. They need someone to check on them. We are responding by organizing volunteers to match them with these seniors who can provide a regular phone call to check up on them. We are also working on a plan, a Fill the Truck plan, to secure donations from the community on specific items that we know seniors are asking for, such as toilet paper and cleaning supplies. We are expecting to continue to see an increasing need as this crisis wears on. In fact, at our call center, we are currently experiencing very high call volume. And again, I ask you, if you need help, to give us a call at 513-721-1025. If you want to help, you can visit our website to keep our phone lines clear. You can also go there for information at www.helpforseniors.org. I ask all seniors in Butler County to please stay home. Commissioner Dixon.
Thank you, Ken. As you can tell, we have many plans in place for all aspects of age in Butler County, and all of our agencies and department heads and volunteers work very diligently in that regard. But this is a time when seniors need to be protected, and they need to know that there's nothing wrong with contacting the Council on Aging. And Ken, I'm going to give them their number again, 513-721-1025, and seek whatever kind of help you may need to help get you through this. Our elderly seem to be a little hesitant to deal with in person or on the internet, but please make this phone call if you need help. Someone will get to you. It's simple. There's no other services provided that you don't want. We're not trying to sell you anything. We're here to just help out. So with that, I would urge our seniors to don't be afraid to make that call. Before we answer any questions, I want to thank you, the media, for coming out today, for getting this critical information out, and for sharing our pleas for materials and supplies. We also want to thank the businesses for supplying the materials and products we need, and the volunteers for their dedication to serve. I'd like to thank all of our agencies, department heads, employees, everyone involved, and there's too many to mention. They're all doing great work, and Butler County is, as far as the preparedness goes, we're as prepared as can be. I'd like to now go to some questions that we might have received on our Facebook.
A lot of people with schools and daycares closed, a lot of people rely on their grandparents, older adults to watch their children. What would you recommend to those people that, may be thinking about that or already doing that?
Whenever you want. I'll let Jennifer handle that.
All right, I'll take a stab at it. Can you repeat the question, please, Erin?
The question was, a lot of people with schools and daycares closed rely on older adults for childcare, to watch their children. What would you recommend to those people that may not have another option?
I would highly recommend good hand hygiene, staying as far apart from each other as possible. Even perhaps more importantly would be to look at all of your different options, and if you're relying on someone over 65 years old, to take care of your children, see if there's an alternate plan that you could come up with. We are most concerned with those over 65. They're our highest risk group, and we really want to put a protective wall around them as best we can. So that would be my suggestion. I know that's difficult to do, and not everyone will be able to do that, but wherever possible, please allow our citizens who are over 65 to be in their homes by themselves as much as possible so that they can have some protection around them.
Many older adults are not as savvy with technology. What would you recommend to those folks in staying in contact with their family and loved ones?
So most of us have telephones, and they work great. You don't have to have a Facebook or Skype or something like that. You can just pick up the phone and call people. I know where my mother lives, people are going up and down the street and knocking on doors and talking to one another with their glass door between themselves. And so they're waving and saying, hey, just checking in, making sure you're okay. Everybody has been receptive to that and really likes it when people come by. So it's okay for seniors to be out and taking a walk when the weather is nice, just not together. 6 feet away, 10 feet away is good. So it's great to wave and say how you're doing and talk through windows or doors and do all of those kind of things that make us all feel good and connected to one another. Just don't do it close together.
This question is for Ken. Ken, what could people expect when they call the hotline number?
So we have staff that are available to take those phone calls, and they will answer any questions that the senior may have. Just be prepared to let us know what your needs are and what it is that you're looking for, and we will we can either provide those services directly or refer you to another community resource if we're not able to meet that need.
There seems to be a lot of misinformation out there. Where can folks go to get credible information about updates and about the coronavirus?
So we're encouraging everyone to get their information from their local health department and the Department of Health, as well as the Center for Disease Control. All of those sources have really good and reliable information.
Commissioner Rogers, do you want to add to that?
Yes, our emergency services also puts on a entry on their website, which is what you want to come up and explain that, Matt, and that is on every night, with numbers.
Thank you, Commissioner. Matt Haverkos with Butler County Emergency Management. So if you were to call the number 785-5800, that is an information hotline provided by the county. That information hotline then leads to the numbers for your local health departments and some other information pertinent to this incident as it's ongoing each day. As the Commissioner referenced, there's also a website, which is butlercountyohio.org /EMA, which has links to the latest updates as well as to those public health officials providing either through your local health department or for the CDC with that information. Thank you.
Ken, there have been reports about fraud and people trying to scam older adults out of money in certain situations. What would you recommend to older adults in regards to that?
Yes, unfortunately, there are dishonest people out there that like to take advantage of a crisis. And thank you for that question, because we want all older adults to be on guard for that, and to double check and not trust anything that's coming to you from an email or soliciting on a telephone call.
I would just like to add to that, there's also a couple other ways you can report this. If you even think that there's a phone call or the knock on door over the internet, that it's not something that is legitimate, or they're asking you to spend money, or
all different kinds of things. You can always call the sheriff's department. He has a division that investigates that for seniors. And you can also call the prosecutor's office. They're very, very aggressive at doing the same thing. Or you can call the commissioner's office. So any of those avenues will get you the results you need. But please be safe, make a call first. I promise you we'll handle it the right way, it won't embarrass anyone. And you need to protect yourself, both monetarily and health-wise, through this time.
There have been a lot of people that are interested in volunteering during this crisis. Maybe that means delivering food on Meals on Wheels. Where would you recommend folks go to volunteer their services?
So we are, at Council on Aging, we're collecting information about people who want to volunteer and dispatching them where they're needed, whether that's delivering meals or making phone calls to seniors who need a daily check-in. And we've been dispatching volunteers in Oxford, Middletown, and Hamilton on an as-needed basis. So we encourage you to contact us at Council on Aging, and we have a volunteer coordinator that is coordinating all of that effort.
Thank you for those questions, everyone. I think that answered a lot of questions that our viewers may have. As you can tell, you can always find this from Butler County Commissioners. We leave the information to the experts when it comes to the health and wellness of our citizens. So we have a lot of great people around us running our department heads and our agencies. So we listen to them, follow the facts, and try and be as efficient and effective as we can. So I'd like to thank all those folks again for pitching in and being part of our team. But we have one last message to give before we go. And this was from our health commissioners. We're all joining in. So her message is,
1, 2, 3,
stay the heck home.